in Five Branches University. And my name is Dr. Ching Ching Chi. And this is my office, carecomfortcure.com. And I have my own clinic outside of teaching in Five Branches University. And I also have a nonprofit organization to train all the students who are actually graduate from the college and Five Branches University or some other acupuncture schools, and they would like to do residency program. So if you are interested of getting into a residency program and then to being trained, to become perfected in the traditional Chinese medicine, then you can go and take a look at this nonprofit organization. But, today you have to start with Five Branches, right?
Yeah.
So, and I'm a faculty in Five Branches University since 2006. You may think like, oh my goodness, this professor looks very young, so how old I am? So, okay, I'll tell you the answer by the end of the lecture, and if you are still interested. But I can give you a little bit notes. Maybe my daughter will come today, so she's already going to graduate from college this year. So, yes, so that's the good things about study traditional Chinese medicine is that I tell all my students, the first person to get benefit is supposed to be yourself. If you can take good care of yourself, then you can take care the people who are under your care. But if you didn't leave as a testimony, right, to your patient, it's almost like you're selling medicine that grow hairs, but you have no hair on your head, right? So as a students in traditional Chinese medicine school, we not only teaching the students how to take care of the patient who is sick, but also we also know and teach you how to take care of the patient where they're still in the process of getting sick. This is called maintenance. So why I'm emphasizing on maintenance is because this is very crucial. And I will start with a very little stories and talks about it, and which I usually share this story with the students within my philosophy and TCM philosophy and history class. So there is a very famous doctor. His name is Bian Chue. And then he have three brothers. Bian Chue and the three brothers. They have two brothers. Two brothers. And these brothers and one day their king was asking Bian Chue, say, hey, Bian Chue, you are a famous doctor. So I know that your brothers are also good doctors too, but I never heard about their names. So why, among all the three brothers, okay, so I can lower down my voice. Can you hear me now? Oh, cool. Okay, so Bian Chue and two brothers. And these two brothers, and then there's one day the king was asking Bian Chue to say, Bian Chue, you are a famous doctor. Everybody know about you. I heard that your brothers also know medicine. So why nobody heard about your brothers? So among the three brothers, who is the best doctor? And guess what Bian Chue said? He says, you know what? Among all the three brothers, I am the worst. He says the best doctor is actually my oldest brother. He says my oldest brother is a very special, gifted doctor because he always can see the disease before it happens. So then they will tell the people who is going to have a severe problem ahead of time. And then ask them to change their lifestyle, change the food they eat, and change their attitude. And guess what? Those people never ever get a chance to get sick. So people thought that my brother don't know how to treat patients. Then the second is actually my second brother. Isn't my second brothers actually already see the beginning of the disease are showing up, and then the symptoms is very mild, but they know that it's going to develop and become serious. That's why they started to treat those patients after they see the symptoms. And then that's my second brother. As far as me, 扁鹊, I treat patients when they are in a very serious condition. So you see me open up people, bleeding people, put needles on the people, and then it seems like I can resurrect people from death. You know, if you go to the history of traditional Chinese medicine, there is an incident of that. So then people saw me do all these miraculous things, but actually I cannot detect them before it happens. So actually I'm the worst. So after the king heard about this, he says, very good. So what is the doctors in the old time? Is the doctors that actually know the things before it happens. So as a traditional Chinese medicine doctors, we always train to be the person actually for a person who is actually before it gets sick. Or you can say traditional Chinese medicine is a medicine to teach or treat people so they will never ever get sick. If you know how to take care of yourself, then you can stop the disease before it ever happens. And then you can prevent the body to go through all kinds of troubles and all kinds of damage. You know, like if you get serious, for example, you already have a big tumor and it's being long lasting, you already ends up in cancer, then you have no way to avoid the things unless you have operations and chemotherapy and etc. So once you ended with that stage, then it's a little bit complicated. But it doesn't mean that you have no chance to get recovered. So you really need to know the medicine very well. So today, my class is that going to share with all of you is a technique that we use to see things before it happens. And then a lot of things that we can do. Observation, tongue diagnosis, post-diagnosis, or just looking at the weather and knowing what kind of weather are you going to have for the future. You know, in a particular year, we already predict what kind of problems people will start getting, and we can do prevention. So in the old time, a lot of the government officials in China, they also know medicine because they can do ahead of time to prevent people to get sick, then can stabilize the government condition. And one very important way of diagnosis and then before things can happen is just by looking at the people's face or the way how they behave. Or if you don't mind, we can ask the people to stick out their tongue. So of course, people walk into our office, they want to get better, they are open to stick out their tongue for us to observe. So today, you know, we say that a picture is better than 1,000 words, right? So a tongue is actually a picture of you, the health condition. And according to diagnosis and looking and learning how to look at people's tongue, we already can diagnose many conditions or the things that it may happen in the near future. So as a TCM doctors, we can help them to alleviate their conditions when they come to our office, or we can also help them to prevent and to tell, ahead of time and to help them to prevent the things getting worse. So up until now, any question? So I'm going to be super fast, and if you don't I'm going to be super fast because I need to do some demonstration, and I'll ask the audience and see any one of you have some conditions. The best is pain, and I will do a demonstration, and hopefully I'll see if I can help you to alleviate your conditions right after I finish my treatment. Okay, so all the doctors in Five Branches University, I believe, especially myself, the things related to saving people, there's no need to keep secret. So today, when I'm going to share how to diagnose your tongue, then there's no secret. Maybe some of the students, they haven't heard of it yet because I'm not the one who teach the tongue diagnosis class. which I don't think the tongue diagnosis class I taught in our school will be much better than me. Okay? And there's something about holographic representation in our human body is that traditional Chinese medicine have a very special way of diagnosis, because we believe that every one of you also agree that we're all coming from a cell, right? And these cells have its own DNA inside, and these cells become 2, and 2 become 4, 4 become 8, and then it ends up become you. So every cell in the DNA have the memories or the signals that carries the information of your whole body. So in the traditional Chinese medicine, very early in our starting the medicine, 2,000, 3,000 years ago, we already started to using individual parts of your body to diagnose your whole body. So we can use the ear. The ear is actually looking at the reverse baby. So by looking at your ear, we can diagnose your whole body. Your hand is also a representation of your whole body. By looking at your hand, we also can diagnose with the condition of your whole body. Of course, there's some, because of the holographic diagnosis systems, we also developed the holographic treatment system. So one very famous is the abdomen needling techniques. So we can use the abdomen to treat the whole body. Or me, I'm specialized in scalp acupuncture. So by looking at the scalp, and we can treat the whole body. So today, if you are lucky and then you want to present yourself as a demonstration in front of everybody, and I'll see if I can help you to alleviate your pain after the scalp acupuncture. And then today in the class is going to be tongue diagnosis. So look at this tongue. Actually, your whole body organs are depicted in the picture in your tongue. So when you stick out your tongue, I can look at your lung condition, your heart condition, your stomach, your liver, your intestine, and your kidney. So, do you want another minute to memorize everything? It is just a reverse person. This is the tongue, and in the tips of the tongue is the lung and the heart. In the middle is the stomach. On the side is the liver, and then in the root of your tongue is actually the kidney and the small intestine. Okay, so it's reversed. The body is reversed. So we believe heaven and earth are one. So we are just part of the universe. So if the heavens or the universe have rains, have sun, have earth, have trees, in our body we also have the same administration. So the sun in our body is our heart. The lung actually can help to promote the raining to send the water to your bladder, and then the bladder is your water underground. So just by looking at this, then we depicted our body is like a universe. So if your weather outside is damp, then you know our inside there is a parts that the body that will eliminate the dampness in the system will start to have more burden. When they start with more burden because they won't try to balance you towards the outside the humidity, then your stomach will start to burden and do more works for you. Then you finally found out, so, wait a second, how come recently I start having some digestion issues that make me either diarrhea or feel bloated after eating? So a lot of people who live in a very humid areas, they tend to have this kind of issue because there is also a humidifier in your system and also dehuman, systems in your body to help you to balance the condition outside. So by looking at the tongue, then we know which part of your body is working very hard and which parts of the body are mild or, working too slow that may create problems in your body. So your tongue is like a bag that is filled with qi and blood. So it's like maybe like Amazon bag. So if you order something outside and you see the bag coming to your house, by just looking at the shape of the bag, will you guess that, oh, what is inside of the bag, right? Same thing. Our tongue also are filled with qi and blood. So if there's certain parts of the tongue is not getting enough qi and blood, then what the shape of the tongue will be changed. It will become like this. So if your tongue is very big and filled, that means that there's too much. Like for example, this patient have a big tummy. Just by looking at the tongue, I know already this person is going to have a big tummy. And look at this tongue. And I have a big hole here. It's like the tennis ball don't have enough of a gas inside, so then there have a hollow area, then you know that parts of the body have weakness. So guess which area is this? I know you guys already watched the picture. A picture tells 1,000 words. Let me see. Can you tell me which part is this area? You don't look at other people. Huh? Kidney and intestine. Yeah. Well, congratulations. You're already half doctor. This person just get the prostate removed because of prostate cancer. So in traditional Chinese medicine, kidney system include reproductive system. So he actually physically removed his prostate. That's why the qi that's supposed to go to support that particular area start disappearing, because there's no need of supplying anymore. There's no more organs there. So naturally, it will become like this. But it is healthy like that? Of course not. Guess why he ends up in my office? Because he cannot pee. The urine flow still have impact. And then because of the energy that supports that, still not fully recovered. That's why walking into my office. Oh, then he actually have another problem. There's a crack in the center, and then a little bit crack in this here. You know what is this part? Lung end in the center. Hard, right? He also have a cardiovascular disease. He also already have a breathing. Yeah. So okay, I think I finished my class today. You want to hear more? Let me give you some more example then. I think you already got it. This is how good our vibration class university teacher. Oh, you see this one? Remember, I say that this is his tongue. This is looking at the tummy, that you know that there's too much stagnation in the stomach and liver area that causes the fat deposit in the middle jaw. And we know that our body is a universe, so you know that the qi is ascending in this side and descending this side. So you know that do you know how to make the dumpling skin? So how do you make dumpling skin circle? You have to keep on turning it, right? Right. If you doesn't turn well, then your dumpling is not circle. It probably is elongated, right? So then, by looking at the tongue's shape, you already know that, oh, this person ascending energy too much, descending energy not enough. That's why the tongue is deviated. So for the way how to tell the tongue how it deviates, you know the person's personality. Because in traditional Chinese medicine, we map each organ with an emotion. For example, okay, I'm going to skip this because a lot of people also have coatings on the tongue. Some people are too white. Some people have no coating. The coating on the tongue is actually how much water is being burned into it become phlegm or dampness in the system. So try to speak something on a plate and then try to cook them. When you start cooking, they become thicker and thicker and thicker. Is that right? So if you see tongue coating on the top of your tongue, it means that your body's fluid is being cooking into some thick phlegm and dampness. And this phlegm and dampness, it could be fat tissues if you want to speak in the Western terminology. So for people who have too much thick coatings on the tongue, means that the body is a lot of junk inside. Okay? So, see, this is the tongue deviation. You see that this person, the tongue, this side is very, very full and seems like there is a tendency of sticking out. But this side of the tongue is what happened. A lot of teeth mark. Feels like there is no qi and blood fill up the gaps. So then it becomes very easy to form into the shape. So because of this, then you start to know that, oh, this person have too strong of the liver and not enough lung. And because of this area of the tongue is lung, right? So besides the lung is what? I'm pointing out, what is this? Shoulder. This side, this person came to my office is because he had a right shoulder pain. And guess what? It's not from injury. It's because his lung energy is too weak, not able to descend the energy. So this person is already went to the Western medicine doctors and get 3 cortisone shots, still not able to raise the arm. So for this condition, it's definitely not injury, not muscular skeleton. Look at the tongue is already deviated. It is actually internal organ energy issues that causes the problem. And same thing, there's another patient here. So I have to tell you this, these 2 women don't have a good temperament because this side is too strong and this side is a little bit weak. So the liver is easy and is also very much in a hurry. Whenever there is an injury, it also shows in the tongue. This is one of my patients who had breast cancer, and after removal and then the reconstruction, and then you see the big scar here, and then you see the scar here too. Is this correspondent to the rest? So that's how we diagnose the patient. If we know how to read the tongue, then you can tell the patient what they have instead of the patient tell you what you have. Then if you can find someone like this, what a blessing in the life. The rest of the life, you find someone to go to take care of your health. Right? Sometimes you have cracks. Sometimes you have hollow area. So for this person, have a big hole here. Guess what problem this person has? Louder? Louder. I hear someone talking but no mouth moving. What's happening?
I think kind of related to either the lung and liver.
This area.
Heart.
What is in the center of your body? Heart is on the upper part. Yes, this person have a very weak stomach. So the motor of the stomach is not moving. So when food enter into the stomach, it moves very slow. Because if it moves slow, then it lasts longer in the stomach. When the food lasts in the stomach longer, what will be the outcome? The body will start to say, hey, the food is still not digested. That's release an acid to help to digest it. So this person, they have acid reflux, but this acid reflux is caused by the motor, the movement of the stomach is too weak and not able to empty the stomach faster. So there's so many ways we can treat stomach issue, but there's only one way to treat acid reflux is to stop acid in Western medicine. So as far as doing a TCM, we know exactly why the acid come out. And then we treat the source of the problem. So for this, you have to strengthen the movement of the stomach. And of course, it matches with our post-diagnosis. post-diagnosis takes a while to really master it. So I'm not going to talk about it today, but eventually if you enter into 5 branches university, then you can learn how to take post. So there's some very simple things that I also think is very good to notice it, is that how do you see your tongue is bigger or smaller? If your tongue is big, means that your body is wet. So then think about like if you put something and soak it in the water and what it will become? Bigger. So how do you know if your tongue is bigger? It's supposed to have a space in between your lips and your tongue. But if you feel them and there's no gap in between, then you have a big tongue. When you have big tongue, that means that your body is full of fluid, water retention. And you guess what? Is if you say, okay, suddenly I start to gain a lot of weight, I have to tell you, it is not fat, it's water weight. So by looking at this tongue, then you know it's water. Of course, there's small tongue, right? Big tongue, small tongue, and deviated tongue. Tongue color also tells us how hot you are, because the color is coming from blood. If the blood gushing to that area very fast, then the color will become what? Red. So if you have a lot of blood gushing into the tongue, that means that your metabolism is fast. So metabolism fast causes people to feel hot. So if you see people's tongue is very red, then this person is hot. Like this one. So flowing in too fast, going away slow, then you will have a red tongue. If it's flowing in too slow, you have a pale tongue. If you're flowing in very fast, but there's some blockage in your arteries, it's not able to move out of that area, your tongue turns into purple. So then you know there's some blood stasis in your system. As a TCM traditional Chinese doctors will help you to remove the blood stasis. Baby aspirin is not going to work. There's something types also light purple is actually coming in very slow and coming out also very slow. So we can use herbs and we can use acupuncture to help patients with this condition. And sometimes you will see bumps in the tongue. So for example, this person have a big bump in the tips of the tongue. This person have asthma. If they see a lot of little red dots like this, every red dots have its own meaning. It's too difficult for your level, but then if you come to 5 branches, you'll learn. And of course, sometimes it also have cracks. Cracks means that, you don't have enough fluid in your body, so your tongue starts to crack like the ground have no water. Of course, sometimes you have moist, full of water. That means that your body is very, very damp and wet. Of course, when the heat gets worse, the tongue turns yellow, and then it could become even dark. This is dark tongue. And sometimes you have no coating, means that you already use up all your nutrients in your body and that particular area. So that organ is very deficient. For that, you have to be very careful. There must be a chronic illness for that patient. Okay, my presentation, a quick review of a tongue diagnosis. This class is supposed to, I think I finished at least 3 classes load for only one presentation for half an hour. But if you are interested, you can learn more when you enter into 5 branches university. And now I'm going to do a demo.